I am Dr. Maria Guevara, delivering this statement on behalf of Médecins Sans Frontières for the WHO Regional Committee for Europe's 73rd session. Universal healthcare coverage is about making adequate healthcare available for everyone without causing financial distress. This year has been a year of grand commitments on the UHC agenda, the UN high-level meeting on universal healthcare coverage in September. With the primary healthcare conference earlier this week, celebrating and reviewing the anniversaries of both the Alma-Ata Declaration from 1978 and the Astana Declaration from 2018, and during the WHO Europe 73rd session. Despite the grand commitments, Médecins Sans Frontières, MSF, expresses concerns that the current plans for universal healthcare coverage are failing, leaving behind the very people that are already most excluded from access to healthcare. I would like to emphasize 3 groups and 3 barriers that MSF witnesses on a daily basis. 1. MSF teams are present in countries where access to healthcare for marginalized or high-burden groups like women and children and adolescents and patients with tuberculosis, HIV, chronic diseases, or malaria and other infectious diseases are undermined by shortfalls in funding and are forced to pay out of pocket. When medical supplies are lacking in public services, patients have no choice but to seek drugs from private outlets at higher costs, or go without medicines entirely. 2. Another group whose health needs are all too often ignored are those of migrants, including refugees and undocumented people. These people often have poorer health outcomes, and health systems needs to be adapted to provide adequate healthcare for them. Yet MSF's experiences in Belgium, Italy, Poland, or Greece, as well as many other countries outside the European region, show that people on the move face significant barriers to accessing even the basic, essential, and urgent services. Thirdly, UHC plans often fail to foresee and adapt during crisis situations, such as conflicts, disease outbreaks, and natural disasters. During such crises, pre-existing vulnerabilities and health service gaps often worsen, and the healthcare barriers for vulnerable groups are disproportionately worsened. These plans to implement universal healthcare coverage must include explicit measures to eradicate these various barriers to access healthcare for these people. As long as these vulnerable groups are missing from the universal healthcare coverage targets, progress towards real UHC for all will not be achieved. Thank you.